You may feel a little awkward reading a title like this, and that's fine. That discomfort is part of why most men never learn the small, practical skills that actually change intimacy. I want to be direct because clarity matters. When I say the right way to touch her breasts, I mean a way rooted in physiology, presence, and safety, techniques that help the nervous system shift, improve circulation, and rebuild trust. I'm Dr. Julia Morgan, a urologist who's worked with men in their 50s, 60s, and beyond for decades, and I'll give you 9 science-backed tips you can try tonight. Before we get into the practical work, tell me where you're watching from in the comments and hang with me through the full message. If this helps, consider subscribing so you can find more clear, actionable guidance. Now, let's get into why this matters and how small changes create real results. When intimacy becomes awkward, the problem is rarely only physical. The body, the brain, and the relationship are in constant conversation. Stress tightens the sympathetic nervous system, fight or flight, so the body protects and withdraws. To reconnect, you need to invite the parasympathetic response: rest, safety, receive. That shift is at the heart of every practical tip I'll describe. Biochemically, gentle, sustained contact and shared, slow breathing increase oxytocin, the hormone linked to bonding and reduced stress, and support nitric oxide production, which helps with local circulation. Those are not magic words. They are mechanisms that explain why presence and touch change what you and your partner feel. I'll be specific about what to do, why it helps, how long, and how often. I'll also share a few short, anonymized patient stories, real men with real concerns, to show what gradual change looks like. I never promise cures, and I never replace a personalized medical evaluation. If you have pain, bleeding, or sudden changes, check with your clinician. First, breathe together before you touch. Purpose: to shift both your nervous systems into a shared rhythm, increasing safety and oxytocin. What to do: sit or lie close, put your palm over her heart or shoulder, and match your breath to hers for a minute. Inhale slowly for 4 counts, exhale for 6. Duration frequency: start with 60 seconds tonight, repeat for 3 nights this week. Build to 2 minutes nightly. Why it works: synchronized breathing stimulates the vagus nerve and signals safety, making skin contact feel less threatening and more intimate. Expected time frame: with consistency, many couples notice increased ease and connection within a few weeks. Second, make the room cue rest, not stimulation. Purpose: to help her nervous system move toward receive rather than defend. What to do: dim harsh lights, lower mechanical noises, choose a neutral scent, lavender or unscented, and keep room temperature slightly cool so your hands feel warm by contrast. Duration frequency. These are setup choices you do before any intimate time. Make them habitual for evening interactions. Why it works: the sensory environment informs the brain about safety. Small environmental cues reduce cortisol and make touch more likely to be interpreted as comforting. Third, start with non-sexual touch that is slow and unhurried. Purpose: to reframe touch as reassurance rather than performance. What to do: place both hands over her shoulders. Move them slowly to the upper chest and lateral rib cage, avoiding immediate focus on the breasts. Use palm warmth, gentle pressure, and slow movement. Think of it as a conversation with your hands. Duration frequency: 2 minutes of slow exploratory touch early in your evening routine, 3 to 5 times a week. Why it works: Slow, soft touch activates C tactile fibers, nerve pathways tuned to effective touch, promoting oxytocin release and lowering arousal that's anxious. Fourth, warm your hands and cue consent. Purpose? To make initial contact comfortable and respectful, reducing surprise and reflexive withdrawal. What to do? Warm your hands under warm water, rub them together, or place them briefly on her lower back before moving upward. Always ask in a simple sentence, "Would you like me to touch you here?" Then pause for a yes, nod, or other nonverbal cue. Duration, frequency? Do this every time you plan to touch intimacy zones. Why it works? Warmth increases local circulation and responsiveness. Asking for consent strengthens trust and makes touch predictable, which supports physiological relaxation. I want to pause and tell you about David, 64, because his story shows how small shifts reframe a relationship. David came to my clinic embarrassed. "I froze," he said. "When we tried, I was tense and she shut down." We spoke about stress, late work hours, and a pattern of hurried performance. I asked him to try 2 changes: night breathing for 2 minutes together and 5 nights of 2-minute warm hands touch that avoided immediate breast contact. He kept a simple log and asked his wife how the touch felt. She answered in one word: safe. 3 weeks later, David described the difference as a new script. He still had nerves some nights, but they were able to laugh and stay close. Sexual encounters were less pressured and more frequent. That's the kind of shift these practices aim to create. Fifth, use the 2-minute handhold with warm palms over the breast as an initial slow gesture. Purpose? To introduce direct breast contact in a non-demanding way that increases local circulation without immediate goal-directed arousal. What to do? Lie beside her, slide your warmed hands gently over the upper chest to the breasts. Keep pressure light and static for 20 to 30 seconds, and breathe slowly. Keep eye contact if she's comfortable. If not, let silence be the companion. Duration, frequency? Start with 1 2-minute session nightly for 1 week and adjust based on comfort. Why it works. Prolonged gentle pressure increases blood flow gradually. Combined with parasympathetic tone, it becomes pleasant rather than stimulating in the pressured sense. Sixth, pair touch with comforting words or reflective phrases. Purpose? To reinforce emotional safety and increase oxytocin through social bonding. What to do? Say short, truthful things. "I like being here with you." "You feel safe to me." Or, "Thank you for being with me." Avoid performance-focused compliments that redirect attention to outcome. Duration/frequency? Weave 1 or 2 phrases into every touch session. Why it works? Words amplify the social cue of touch. Hearing calm, affectionate language signals the brain that vulnerability is permitted. Seventh, practice map and mirror. Purpose? To pay attention to feedback and mirror her pace to build attunement. What to do? Map means you check in. Does this pressure feel okay? Mirror means you match the tempo of her responses. If she sighs and slows, you slow. If she withdraws, you pause. Duration/frequency? During every intimate interaction, aim for 1 explicit check-in and adjust immediately. Why it works? Attunement builds trust, which is a prerequisite for deeper physical intimacy. Eighth, use micro-movements to encourage circulation rather than force. Purpose? To support gentle changes in local blood flow and avoid overstimulation. What to do? After static touch, introduce a tiny circular glide with the pads of your fingers, no more than a centimeter, and keep movements slow, 3 circles per breath. Duration/frequency? 10 to 20 slow micro movements per side once or twice per session. Why it works? Small, consistent movement encourages nitric oxide-mediated vasodilation without abrupt shifts that could trigger anxiety. Ninth, finish with grounding contact and an aftercare check-in. Purpose? To close the experience with reassurance and to translate the moment into relational safety. What to do? And with a palm over her sternum or shoulder, hold for 30 seconds while breathing together, then ask, "How did that feel for you?" Or, "Would you like more of that tomorrow?" Duration/frequency? Every session should have a predictable close. Why it works? Predictable endings reduce rumination and reinforce the pattern that intimacy is safe and tender. Let me give you another composite vignette. Mark, 58, and his partner had drifted into separate bedrooms after years of interrupted sleep and the constant glow of screens. Mark's worry fed his tension. If he failed to perform, he feared rejection. I coached him and his wife on 3 small practices: a 20-minute evening walk 3 times a week, a bedtime breath and hands ritual, and a rule: no devices in the bedroom. After 6 weeks, Mark reported that his mornings were calmer and that he felt less urgency at night. His partner said she appreciated the walks and the reintroduction of touch into non-sexual parts of the day. The pattern that restored them wasn't one dramatic act. It was consistent, tiny acts that signaled care. Throughout these tips, keep a few practical safety and dignity rules. Avoid rough pressure. Never apply direct, sustained, painful pressure to the breast tissue. If she shows discomfort, stop. If either partner has recent surgery, active infection, lumps, or suspicious changes, postpone these techniques until cleared by a clinician. If either of you has a trauma history, consider professional guidance from a therapist trained in trauma-informed bodywork. Consent, warmth, and listening are non-negotiable. Now, some concrete micro-assignments you can implement this week. Tonight, 5 minutes. Before sleep, sit next to your partner and do 1 minute of synchronized breathing, followed by 2 minutes of slow, warmed hands exploration over the upper chest, and finish with a 30-second grounding hand on the shoulder while you ask one reflective question. The purpose is to create a predictable, low-pressure interaction. Repeat 3 nights this week. Second assignment, daytime check-in. Send a text at lunch that says, "Thinking of you. Want to walk tonight?" Aim for 2 20-minute brisk walks this week. Third assignment, environmental cue. Remove screens from the bedroom and dim lighting for sleep at least 3 nights. These are small and measurable. Let's be practical about physiology without getting lost in jargon. When you stimulate oxytocin through gentle touch and social connection, cortisol, the stress hormone, can lower, which reduces fight or flight drive. Nitric oxide, produced in endothelial cells and through gentle activity, supports microvascular dilation. This is one of the ways slow, warm touch helps skin and superficial tissues feel more responsive. These processes are modest and gradual. They may enhance sensation, mood, and responsiveness over weeks rather than hours. A short, guided practice now you can do alone or with your partner. Sit or lie facing each other, close enough that your knees touch. Place one hand over your own heart and one hand over hers with her consent. Breathe in for 4, out for 6. On the exhale, soften your jaw and relax your shoulders. Keep your touch static and warm for 1 full minute. After that minute, ask, "Would you like me to move now or rest like this a bit longer?" Use her answer to guide the next step. I've also observed patterns in what undermines recovery: rushing, checking the clock, performance-focused comments, and making touch contingent on outcome all reinforce sympathetic arousal. Replace those with curiosity, patience, and openness. If you notice your own anxiety rising, your palms sweating, your thoughts racing, stop and return to the breath exercise. Your body's response is reversible. You can learn to downshift. Nutrition and movement support these changes too.
Instruções para síntese de fala. Instruções para síntese de fala. Você é um narrador/palestrante com voz potente, forte e autoritária. O tom deve ser firme e inabalável. Contexto de continuidade. A frase anterior era: Nutrition and movement support these changes too. Você está no meio de uma frase, pensamento. Mantenha o ritmo e a força vocal sem quebrar a conexão. Haja como se estivesse transmitindo uma verdade fundamental. Small swaps matter. Adding nitrate-rich vegetables such as beets or leafy greens once daily can support nitric oxide pathways. Think a small salad or a side of steamed greens. Include a handful of nuts for healthy fats and hydration with a glass of water with lemon. These are not prescriptions, but lifestyle nudges that complement touch-based work. Sleep matters. Aim for consistent bedtimes when possible and remove bright screens at least 30 minutes before lights out to support melatonin rhythms. Another patient, Robert, 67, came in fearing the worst after months of avoidance. He'd tried pills on and off and felt more frustrated when they didn't always work. My first recommendation was behavioral, slow touch, breath synchrony, and walks with his wife. He also kept an evening notebook to offload anxious thoughts, what he called the mental parking lot. Those simple routines created space for his body to respond without pressure. He didn't report a sudden cure, but he and his partner said their encounters became more frequent and less fraught with expectation. A common question I get is, how long before I notice anything? The honest clinical answer is, it varies. With consistent daily practice, many couples notice improved ease and more natural sexual initiation within 3 to 8 weeks. Physiological shifts like improved local circulation or a calmer baseline for the nervous system can be gradual. The key variable is consistency, not perfection. There are practical boundaries to observe. If touch causes pain, numbness, or significant discomfort, stop and consult medical care. Breasts have many structures. Persistent pain or a new lump warrants a professional evaluation. If you or your partner have cardiovascular conditions that affect exertion, choose walks or movement levels appropriate for your health status and discuss changes with your doctor. Now imagine a simple daily vitality cycle you can integrate. Morning movement to stimulate circulation. Midday micro reset, the 2-minute breathing exercise at your desk or before dinner. Evening presence routines that include the breath and touch protocol. This cycle links movement, circulation, and parasympathetic activation across the day. So intimacy is not an isolated event, but the natural extension of a calmer system. Start with one habit and add the others gradually. The cumulative effect is what matters. Before I close this segment, try a short, practical prompt you can use tonight. Set an alarm 30 minutes before bedtime as a gentle signal to both of you that the evening is shifting toward rest. Use that time to remove devices, dim lights, and do your 2-minute breath and warm hands ritual. Keep the language simple. Would you like to try our 5-minute ritual? Framing it as a shared experiment reduces pressure. We've covered the physiology, the 9 tips, patient examples, and specific assignments for tonight and the week.
There are nuances I'll expand on: how to adapt for different levels of sensitivity, how to use touch if one partner has a medical condition, and how to partner with therapists when trauma history complicates physical intimacy. For now, pick one micro habit to try this week. Tomorrow, you'll have a chance to notice how it felt and adjust. If you want to hear more, share in the comments where you're watching from and which one habit you'll start this week. If this guidance helped you, consider subscribing and sharing so others can find practical, respectful strategies for rebuilding closeness. I'm Dr. Julia Morgan. Be kind to yourselves as you practice. These are skills, not tests. One last layer before we close: how to translate these general principles into careful, individualized plans when sensitivity, medical history, or trauma change the rules of the road. These are common, and they require both humility and teamwork. Trauma-informed adaptations. If one partner carries a history of sexual trauma, the aim is safety first. Trauma doesn't mean the end of closeness. It means we slow down and broaden the definition of intimacy. Consent as ongoing conversation. Replace one-off permission with small, explicit agreements. May I hold your hand for 2 minutes? Would you like me to place my hand on your shoulder now? Keep questions specific and time-limited so the person knows they can say yes or no without commitment to anything beyond the moment. Predictability and control. Give choices whenever possible. Room lighting, where to sit, how long to touch. Use a simple scale. Would you like me to stop, soften, or keep going? So control stays with the person receiving touch. Anchor with breath and orientation. Before any contact, take 3 slow breaths together and name non-sexual facts in the room. I see the lamp. I hear the hum of the heater. Those small orientation cues reduce dissociation and restore presence. Use non-erotic touch first. Shoulder, forearm, upper back. Touch that in most people does not automatically sexualize the body, so the nervous system can register calm without triggering old patterns. Professional partnership. Trauma histories often benefit from a therapist trained in both trauma and somatic work. If flashbacks, panic attacks, or intense dissociation occurred during these practices, pause and refer to a trauma clinician who can integrate exposure and stabilization work safely. Adapting for medical conditions. Many medical factors change how we approach touch and sexual activity. Here are concrete adaptations I use with patients. Pelvic surgery. Example, prostatectomy, hysterectomy. Expect altered sensation and new patterns of arousal. Begin with external touch, very light pressure, and explore sensation slowly. Pelvic floor physiotherapy can help rebuild coordination and reduce guarding. Consider timed, short walks to rebuild confidence in exertion before attempting more intimate encounters.
If either partner feels pressured to perform, stop the exercises and seek outside help. Closing encouragement. These practices ask you for respect, patience, and repetition. They are habits for a nervous system, not a performance for an audience. If you begin to notice softer breath, fewer racing thoughts, or a partner who initiates a brief touch without the old story of failure, celebrate those small shifts. They are the building blocks. If you found this helpful and want more specific protocols, step-by-step sensate focus scripts, trauma-informed consent templates, or a printable 12-week scaffold, let me know in the comments where you'd like the next resource to go. Share one small habit you'll try this week. Hearing what others choose helps normalize the slow work of rebuilding closeness. Be kind to yourselves. Practice the rituals as experiments, not tests. I'm Dr. Julia Morgan. Take the smallest next step tonight and notice what changes by the weekend. If you want one concrete place to begin tonight, try this short, safe script that fits into 10 minutes and prioritizes comfort over outcome. 10-minute trauma-informed sensate focus mini ritual. 1. Set the scene. 1 minute. Sit or lie where you both feel safe. Agree the pause word and that either person can stop at any time. Keep a glass of water within reach. No expectation of sex. This is practice for calm and connection. 2. Ground together. 2 minutes.
Sit back to back or side to side, eyes closed. Breathe in for 4 counts, out for 6, together. Keep hands relaxed on your laps. 3. Non-demand touch, 5 minutes. One partner offers one hand to the other's forearm or shoulder. The receiver signals yes or no with a small nod or shake. If yes, the toucher uses the pads of their fingers. Light pressure, slow strokes no longer than 5 seconds each. No images, no performance, no trying to make something happen. 4. 2-minute cleanup, 2 minutes. Stop, sip water. Each person names one thing that felt okay and one request for next time. Short phrase. No analysis, no blame. A guided breathing script you can use in the moment. Place your hands wherever they feel calm. Breathe in through your nose. 1, 2, 3, 4. Hold. 1, 2. Breathe out. 1, 2, 3, 4, 5, 6. If your mind wanders, gently bring it back to the rise and fall of breath. Keep your voice low. If you need to stop, say pause. 3-step progression for the first 4 weeks. Week 1. Safety and rhythm. Daily 3 to 5 minute breathing practices together. 2 mini rituals of non-demand touch, 5 to 10 minutes. Focus, predictability, and co-regulation. Week 2. Sensory variety. Keep rituals, but vary location and texture. Soft blanket, cool hand. Add 1 to 2 minute handhold with eye contact only if both feel safe. Week 3. Increase duration. Add 1 longer ritual focused entirely on non-genital touch and checking in with the 2-minute cleanup afterward.
Guia de estilo e instruções para síntese de fala. Você é um narrador, palestrante, com voz potente, forte e autoritária. O tom deve ser firme e inabalável. A frase anterior era "Practices and seek outside support immediately". Esta é a conclusão. Aumente a emoção para o nível máximo, mantendo a potência e termine com uma pausa solene e impactante. A short script for clinicians to introduce this work in session, 60 to 90 seconds. I want to offer a set of small, time-limited practices you can try that do 2 things: teach your nervous systems to co-regulate and give you data about what helps and what doesn't. We'll start with non-demand touch and breath work, no expectations of sex. You'll agree on a pause word and a 2-minute check-in after each attempt. We'll treat each practice as an experiment. Notice small changes in comfort, not whether sexual function returns. If things don't shift after a few weeks, we'll consider specialty referrals. Resources and further tools you might request. Sensitate focus scripts with timed audio guidance, 2-minute, 5-minute, 15-minute versions. Printable trauma-informed consent and safety statement templates. A 12-week printable scaffold with weekly checkboxes and space for the win log. A short clinician referral one-sheet for pelvic floor PTs, sex therapists, and sexual medicine physicians in your region. Ask your clinician to provide local names. A final clinical note. Recovery of connection after distance, pain, or trauma is rarely linear. Small, steady experiments that prioritize safety and predictability change nervous systems over time. Celebrate micro-movements, softer breath, a shorter pause, fewer catastrophic thoughts. Those are the signs of real repair. If you'd like more step-by-step guides, audio scripts timed to the exact rituals, printable consent templates, or a full 12-week workbook, tell me which one and I'll prepare it as a downloadable resource. Be gentle with the pace. One small, calm touch tonight is progress. Dr. Julia Morgan, clinical sexologist and trauma-informed therapist.